So my name is Kim Booker and I'm a physical therapist. So first of all, everyone has a pelvis and everyone has a pelvic floor. It's made up of many muscles and many nerves that provide a lot of support for the internal organs and support for the core musculature and a lot of just control for bowel and bladder movement. So pelvic floor therapy is treatment of any dysfunction in that pelvic floor. So it could be pelvic pain, urinary incontinence, bowel, bladder dysfunction, or even sexual dysfunction. You may notice that you're having some back pain or hip pain, and you may actually have some dysfunction in the pelvic floor that you're not aware of. So that is definitely important if you've been having treatment for your back or hip pain, or if you've had trauma to that area and you're just not getting completely better. That could be a red flag or sign that maybe there's something more going on in the pelvic floor. We can treat men and women. We can treat anyone, 18 to 24-year-old athletes that do a lot of strenuous activities, up to women that have had children, postpartum pregnancies. We can also treat older population as well. Usually people are being referred to us, but again, doesn't necessarily have to be referred to us. We can have someone, if they're having concerns, just come in for a quick check where we can just talk to them, discuss the symptoms or signs that they're having, and be able to help them identify if it is something we can treat. So they don't necessarily have to have a referral. A lot of people do already because it's again, something they maybe have been dealing with for quite a while. We keep it very discreet, very private. It's very professional, with our treatment, and it's very individual, as far as what is the certain needs of that person. And then also we have ways of assessing their ability to contract or relax those muscles. We have real-time ultrasound, which gives us a picture for great feedback of whether or not they are contracting the muscles appropriately. So that can also help with making sure they're doing proper technique with the exercises. So the pelvis is attached to the spine and the lower body, and there are a lot of muscles in the back and the hip that attach to the pelvis, and so you again may have back pain or tight hip muscles, and that could be contributing to tightness in the pelvic floor, again that dysfunction in the pelvic floor. So again, you may be receiving treatment for low back pain and thinking you just have low back condition, but it may actually be coming from your pelvic floor. If you don't address this area, again, it's the foundation of everything above and below. So it can lead to other dysfunction in other areas, even your neck or your mid-back, or even down to balance issues, which I know sounds hard to believe, but it can contribute to anything above and below that area. It can lead to future problems with the organ prolapses that, again, then you may get to the point where you are last resort for needing surgery, and surgery is not always fixing the underlying issues. Same with medications, not always fixing the underlying issues. So it's important to treat this early. We can treat this. We do see a lot of success with this. There's a high percentage rate, 80 to 90% do see success, whether it's completely cured or improved. So it is something treatable, and again, something to avoid further dysfunction.